going, Timmy?
Yeah, check out tomorrow. I better not see a grain of sand in my car, eh?
Terrence, hurry up, let's go.
It's a bunch of haters, man, because I just switch and I need to talk to you.
Ain't like you see you later, right?
Put on all your seatbelts, let's go. Hold up to me. Terrence, what are you doing? Buckle up.
Man, I'm in the back seat. I'm getting right around the corner to the house. Nah, boss. People will be speeding down this stretch all the time. If you really want to live to see Crystal later, you got to buckle up.
Ridiculous. Let's go, Timmy. I gotta go home and get fresh anyways.
Me know what Crystal saying you anyway, dog.
Seatbelts save lives. Buckle up. It's your life. It's our law. This message is brought to you by the Virgin Islands Office of Highway Safety.
Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 Update for the week of June 21st, 2022. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Joining me this afternoon is Dr. Esther Ellis on behalf of Health Commissioner Justa Encarnacion for the latest COVID-19 data and information on where Virgin Islanders can get a COVID-19 test, vaccine, and booster shot this week. So without further ado, I will turn over this week's briefing to Dr. Ellis. Dr. Ellis?
Good day, Virgin Islanders, and thank you, Director Mota, for having the Department of Health update everyone on the current COVID-19 statistics and other health-related situations. As of today, we have 184 active COVID-19 cases, and our positivity rate is 7.67%. There are currently 4 COVID-19 positive patients hospitalized, 3 on St. Croix and 1 on St. Thomas. None are vented. There has been a 108th fatality, a 75-year-old male on St. Croix. My condolences go out to the family. We have 134 active cases on St. Croix, 49 on St. Thomas, and 1 on St. John. A total of 435,007 tests have been completed, and 20,669 were positive. Exciting news, the Pfizer-BioNTech COVID-19 vaccines are authorized and approved for 6 months to 4 years old as a 3-dose primary series. And has already been the case, that's also available for 5 to 17-year-olds as a 2-dose primary series. In addition, Moderna COVID-19 vaccines are authorized for 6 months to 5 years old as a 2-dose primary series. As of today, anyone 6 months or older can now get vaccinated, which is very exciting news. As a reminder for all parents of children or individuals accompanying these young children for vaccines or boosters, you need to bring an ID for yourself, the parent or the guardian, and the child, as well as the child's birth certificate. These pediatric shots are available on St. Croix at the CVC at the Charles Harwood Memorial Complex only on Fridays from 8 a.m. to 4 p.m. On St. Thomas, they are available Tuesdays and Fridays at the Maternal and Child Health Clinic, or MCH Clinic, from 8 a.m. to 4 p.m. Please call for an appointment at 340-777-8227 or schedule online at covid19usvi.com/vaccines. As always, walk-ins are welcome. On St. John, pediatric vaccines and boosters are available on Wednesdays between 1 p.m. and 4 p.m. at the Port Authority gravel lot. The public is advised that the schedule for the COVID-19 testing on St. Thomas is changing slightly. As of Wednesday, June 22nd, tomorrow, the drive-through testing normally done at the Schneider Regional Medical Center loading dock are canceled just on Wednesdays. Testing will continue to take place on Monday, Tuesday, Thursday, and Friday between the hours of 9 a.m. and 11:30 a.m. This new schedule is being adapted so that the limited DOH personnel may continue to provide the routine once-a-week testing and vaccine services on the island of St. John. So again, Wednesdays only, no testing on St. Thomas, but there will still be testing on St. John. Additionally, the St. Thomas public is advised that starting today, Tuesday, June 21st, anyone visiting the community health clinic adjacent to the Schneider Regional Medical Center is now required to enter the building through the first floor main lobby entrance. This requirement pertains to everyone seeking appointments for COVID-19 vaccines or visits with other community health services. The Department of Health continues to thank the public for your understanding and patience regarding the COVID-19 vaccine incentive gift cards. So these were gift cards designed to be given out in April, and they're still being processed. We have not forgotten those who received their vaccination or boosters back in April, and we have ordered the cards. We expect these cards to be available shortly, and we'll issue a press release as soon as they can be picked up. For the latest COVID-19 information, visit the U.S. Virgin Islands Department of Health Facebook page or our website at www.covid19usvi.com. I would also like to urge everyone planning on attending the St. John Carnival events to remain vigilant while participating in any of these week-long events. As we have clearly seen after both the St. Thomas Carnival and the St. Croix Egg Fair, COVID cases did increase. That's why it's up to each and every one of us to self-monitor our environment and respond appropriately. If that means wearing a mask in a crowded situation, that will protect you from bringing COVID back to your family. COVID-19 is not going away anytime soon. Our situation following our own large events should serve as a stark reminder that the coronavirus continues to be a real health threat. So please remember that getting vaccinated and boosted is the best protection against severe disease from COVID-19. Please feel empowered to evaluate your surroundings and respond accordingly. If you are in a crowded setting among people whom you do not reside, consider following all the standard COVID-19 precautionary measures, such as wear a mask, socially distance, wash your hands, frequently wash your hands, and sanitize your hands. The Department of Health is continuing to track the current monkeypox outbreak. As the department has said previously, monkeypox does not naturally occur in the United States. However, there is an outbreak, but historically cases have occurred in association with international travel or importing animals from areas where the disease is more common. This virus is typically transmitted as a result of close skin-to-skin contact, which we're seeing with this current outbreak, or sexual activity with infected persons. No cases have been confirmed in the territory thus far. However, antivirals are available and can be prescribed as treatment if needed. So thank you again for the time to share this information with the public. Now, back to you, Director Mota.
Thank you, Dr. Ellis. Earlier this month, Governor Bryan announced the issuance of $25 million in income tax refunds at the end of June, in line with the Brian Roach administration's fiscal year 2022 budget plan to pay at least $25 million in refunds each quarter, and in line with the governor and lieutenant governor's commitment to erase the years-long backlog of past due refunds owed to Virgin Islands taxpayers. I am pleased to announce today that those refunds have started going out to taxpayers, with 5,152 checks going out last week and another 5,513 scheduled for issuance later this week. Most of those checks, 8,637, are for refunds owed to tax filers for tax year 2020, meaning that most tax filers owed a refund for tax year 2020 who filed their returns on time and had not had any issues with their filing will likely receive their refund in the latest round of payments. This latest round of payments brings the Brian Roach administration closer to its goal of paying refunds owed to tax filers in the same year they file their returns, something that has not been accomplished in the past. In closing this afternoon, I want to remind the community that the deadline to apply for the GVI Fellows Program is July 15th. The GVI Fellows Program is a 2-year paid fellowship where Virgin Islanders with a bachelor's degree or higher in project management, economics, business administration, construction management, accounting, engineering, finance, and more can work for 2 years on a 6-month rotation within the government of the Virgin Islands' financial and project management agencies, including the Office of Management and Budget, the Department of Finance, the Bureau of Internal Revenue, and Office of Disaster Recovery. For more information on how you can sign up, or just for more information on the GVI's Fellows Program, you can visit the Department of Personnel's website at dopusvi.org. Again, visit dopusvi.org for more information and to sign up for the GVI Fellows Program. Finally, before we conclude this afternoon, even as we move to treat COVID-19 as an endemic, and although, knock on wood, the virus's impact on our community is less severe than in the past, there are still, as Dr. Ellis mentioned, real-world impacts, mainly the disruption of our regular operations to many of our government agencies and offices. If you have difficulty reaching an office at any government agency, I encourage you to call your island's administrator, Mr. Samuel Sanes in St. Croix, at 773-1404, Mr. Avery Lewis in St. Thomas and Water Island at 774-001, or Mrs. Shakima Jones-Sproul on St. Thomas at 474-5762. I'm certain that they will do everything within their power to assist you and help you get connected to the services you may require, or help you get answers to the questions that you need answered from any of these government agencies that you may be having difficulty contacting during this time. That concludes our briefing this afternoon. I will take any questions from the media if there are any, and I'm being signaled that we do not have anyone joining us virtually this afternoon. So we will see you on Monday, June 27th for next week's briefing. Thank you for joining us and enjoy the rest of your afternoon.